see, if you want to examine the knee, we will apply the policy of joint examination. Look, feel, move. Here, if you look, there is wasting. Search for wasting, and also for scars. There is multiple scars. If there is redness of the joint itself, if there is swollen joints, and if the patient has deformities of the joint, or also deformities in the ramp. This is look. And then we will go for feel. For feel, remember 4 T's, please. 4 T's. T. The first T is the temperature. Try to compare with neutral part and with the other joint. And he has, yes, here is more warmer than the neutral part. Means there is a pathology going on, running on. This is the first T. The second T is the tenderness. The tenderness, you will examine the tenderness by going over the joint line. The joint line like this one, please, like this one, like this one, like this one. And then you will escape the scapula, the patella. You will not examine the patella. And then after, please you see, you will go after then for thickening, synovial thickening, and the subcutaneous tissue will be also thickened. And try, please, while you are examining the gentleman, to examine yourself, to see you are passing your finger over yourself, over a bony prominence. But here, you will not catch any bony prominence. There is thickening of the skin here. And not the skin, sorry, subcutaneous tissue and synovial flow, synovial membrane. And here, also the same, like this one. Finishing this, please, do you see, you will go for, after the temperature, tenderness, and thickening, you will go for, yes, tapping for synovial flow. You will do like this one, but not tightly. If you will come more nearer, not tightly, please, like this one. If you will be tight, the floating of the patella will not be clear for you. And by this technique, it is floating. Okay? Finishing this, you finish the 4 T's. You will go for what? You will go for, yes, move. Move must be started by حاجة من الحاجة شوية كده معلش جبت لكم من هنا كده بس وشه لا. Yes, by the active movement, there is crepitus. Okay, and then I will go by myself, keeping in my mind the range of movement like this one, and not more. Otherwise, it will be painful for him. There is also crepitus step, and after this I will go for stability of the joint. Stability of the joint, we have 4 ligaments. The anterior and posterior cruciate, medial and lateral collateral ligaments. And that's why if you want to examine, you must put the patient in 90 degrees. Okay? If we have a midline passing by the knee like this one, for normal people, if you will move to the right or to the left, it must not move by more than 10 degrees. 10 degrees to the right or to the left. This is normal. But if more than this, at that time, while you are going to medially, like this one, you are examining the lateral collateral. If more than 10, at that time, the lateral collateral will be affected. And if you are going outside, you see, more than 10, at that time, the medial collateral will be affected. And then we will examine for the anterior posterior cruciate by the drawer test. اختبار الدرج. How? Now I will catch the epicondyles like this one of the femur, and I will try to move the leg. You see, is it 10? More than 10. More than 10. Means the lateral collateral here is affected. And then I will go laterally. More than 10. معلش أنا كحلاوة آسف. More than 10. At that time, he has the medial collateral also is affected. Finishing this, I will go and examine the anterior and posterior cruciate by the drawer test. How the drawer test, please? By, yes, remember while we are kids, لما كنا أطفال, we are playing by the guns, طاخ طاخ طاخ, like this one. Put your fingers like the same, like this one, and then below the knee like this one. And the 2 indices will be supporting the epicondyles here, and tibial tuberosity between the 2 thumbs. And your elbow over the foot. And then you will go forward and backward, not up and down. No. Try to look here, please, to see while I am going forward, Normally it will not move by except millimeters, but now try to see here, please. Do you see? Do you see?
Yes.
Means while I'm examining the posterior cruciate, it is out of function, torn. And while I'm going back, it is also going back more. At that time, also the anterior cruciate is torn. This gentleman cannot go upstairs or downstairs. Finishing this is now we have tested this gentleman 4 T's, 4 feel, and 4 ligaments. And I will go to examine the hip joint by the FABR test. FABR is the mnemonic for F stands for flexion, AB abduction, ER external rotation. Means you will put the patient in figure 4. معلش يا عم كحلاوي هي مرة واحدة بس. ما تخافش معلش هي مرة واحدة. Like this one and like this one, and his leg must be above the knee. اوكي خلاص يا عم كحلاوي خلاص مش هتعبك اكتر من كده. اوكي he is in pain because his hip joint in any case to examine one joint you must examine the proximal joints. Here the hip joint only. The technique will be like this one, please. And then you will press lightly over the knee. If there is pain in the hip, at that time the patient has the hip involved. It can be this. It can be the source of the knee involvement. Okay. Sorry. Referred. Yes. Referred pathology. Finishing this, please. After the FAB test, you will go and examine the back. If you will forget Muhammad, this is horrible thing. This fatal mistake to examine for Baker cyst, and he has. تعال على جنبك كده يا عم كحلاوي. أساعدك. Try to see, please. To see the Baker cyst. Feel it. Feel it, please. Cystic.
Yeah.
This is cystic. Right intersection. Exactly. See it, please.
Here.
Yes. And at that time, you can ask the examiner, can I go for trans-illumination test to buy torch?
Okay.
If it is trans-illuminant, at that time, yes, going with fluid inside the trans-illumination.
We put the
Sorry?
torch here, doctor?
Sorry?
There's no budge in this one.
Yes, but here, yes.
Where we put the torch?
Here,
Here on it.
yes. If you have a torch, you have a torch? Okay, at that time you will throw it here. Okay, at that time it will appear as fluid inside the ارجع من حلاوة ماشي. This is how to examine.